Nicola Hill joins us now live from London. So Nicola, I know only a few days ago there was a report of a man who was released from a hospital having survived COVID-19 only to then die from the fungus. Is there any effective way to treat this?
Yeah, it's certainly something that's very worrying. I mean, it seems to be a myriad of fungi that are affecting people in hospital, particularly in India. As you just said then, Michelle, this particular form of Candida auris, was only discovered a decade ago, and it is the one that most hospitals really fear because it's so deadly. I was talking to Professor Paul Hunter this morning, who's Professor of Medicine at the University of East Anglia and an expert on fungal diseases. And he told me that basically this is a form of yeast. Now, many of us have heard of Candida. We know the more common Candida infection, thrush, and it is linked to this, but it's a more deadly form. The reason it's called the white fungus is if you think of, for example, cancer patients. Now, they often get this thrush, a yeast infection in their mouth, which has to be treated with antifungals. And that's because the medications they're on for their cancer has wiped out all the healthy bacteria in the body. And that's how the yeast can take control. So the same thing's happening with these COVID-19 patients. But unfortunately, it's a much more damaging, a much more fatal form, this Candida auris. And that's what's so worrying. Yes, there are drugs available, but they're not particularly working because they are resistant to the antibacterials that we know. I asked Dr. Simon Clark from Reading University this morning, I said to him, well, why is this? And he said, well, you know, not all antibiotics work against all infections. And if this particular Candida auris fungal infection is not responding to the antibiotics, it's because they basically don't work against it. They haven't been designed to work against it. And Professor Hunter was saying to me that apparently 90% of the ordinary antifungals have no effect whatsoever on this Candida auris.
You know, I'm curious, why particularly in India? Is it just because of the number of cases we've seen there? Or are we seeing these kinds of infections in other places too? How widespread is this?
Well, Candida auris, we know, flourishes in hot temperatures. So obviously because of the weather in India, that's one of the reasons why. And it's not the only form of fungal infection. The two others are the black and the yellow ones. Those are a type of mold. And they exist. I mean, all of these fungal infections exist everywhere. You know, the yeast ones exist in our body. The black and the white funguses, they're in the air. The spores are in the air. It just depends on how seriously ill somebody is as to whether the fungus can get inside the body. Now, if you've got people on a COVID-19 ICU, they're on ventilators, they've got other tubes into their body. So this is how the fungus can get inside, and they can get in the bloodstream and then to the lungs. In countries like here in the UK, in Turkey, a lot of more first world countries, patients in ICU are given antifungals and antibacterials prophylactically. And there are ones that are at least 70% effective, 30% not, but 70% effective, but they're expensive. So that's another one of the issues you've got in India, is the cost of the treatment.
Okay, thanks so much for looking at that problem for us, Nicola.